just be right here. Let you guys be right here. Yep. We'll do this. Okay, troopers, why don't you guys be kind of right over here, the four that were involved.
Bang on it or something.
Yep.
Company phone.
And then why don't you guys
Might
step
pay
back
for
just a
another
little
one.
bit, right here. Yep. Mom, why don't you guys come over here? You guys stand where I'm standing as a family. Okay. Okay. And then, yeah, if you guys want to flank to the sides there, and I think we're good. Okay, Bruce, I think we're good.
Okay, we're all set? All right, good afternoon, everyone. I'm Bruce Gordon with the Minnesota Department of Public Safety. Thank you for joining us today, and for those of you watching online across Minnesota, thank you for joining us as well. The only reason we are here today is because of the amazing teamwork of everybody standing behind me. Every one of these professionals played a critical role in saving the life of Jenapher Blair on July 21. Just after delivering her baby girl, Adalyn, Jenapher experienced complications and significant blood loss. Without enough blood at Hutchinson Hospital, the call for additional blood was made. You will hear from several people today, including Jenapher, who will tell her story. We expected to have Dr. Amy Ellingson-Itzen, who would speak on behalf of the team. She is delivering a baby as we speak. So the doctor is not able to join us. However, we do have other people that were involved in the case on July 21st, including the nurse anesthetist, Brenda Tiemann, and Dr. Mary Bray. They will join us today. They will also provide you with the spelling of their names when they come to the podium. You'll hear from Trooper Brett Stricker, who will speak on behalf of the team of troopers and pilots who transported the blood from St. Paul to Hutchinson on July 21. You'll hear from Bob Bruce with the American Red Cross. He'll talk about the shortage of blood and the need for donations, especially at this time. We also want to acknowledge the dispatchers who took the initial call for blood, representing those dispatchers who could not be with us, the Minnesota State Patrol Statewide Director of Communications, Tim Boyer. We start today with Colonel Matt Langer. He is the Chief of the Minnesota State Patrol.
Thank you, Bruce. My name is Matt Langer, and I have the honor and privilege of serving as Chief of the Minnesota State Patrol. Today is one of those events where I have a series of talking points, but I feel like I don't even need them. In fact, I don't even think we need to speak, because if we look at this family, and we look at Jenapher, and we look at Steve, and we look at Adalyn, and we look at their kids as a family, that's the story. But I do have good news to share about the great work of the Minnesota State Patrol as we coordinated with everyone that you see behind us to help save Jenapher's life. And oftentimes when we take the podium, we're talking about a fatal crash or a serious injury crash or some public safety dilemma. But today it's all about good news. And I'm very happy to report that the State Patrol is involved in this type of work all of the time. In fact, about 100 times a year, between 60 and 90 times a year, the State Patrol is involved in running blood, as we call it a blood run, across the state of Minnesota for people in need just like Jenapher. And in this case, we have a host of people here because it involved a lot of members of the Minnesota State Patrol. But I'll just start by saying here's how this went down on July 21st when Jenapher needed this blood. The hospital recognized the need for blood to save a patient's life, and we can see Jenapher. They got a hold of the Red Cross, and the Red Cross is very good at figuring out how to get the blood where it needs to go by using the State Patrol and other means, but especially us if it's an emergency. So in this case, the American Red Cross called our dispatch, and you can see Michelle standing in the back. Our dispatcher took that phone call, which started a cascading sequence of events involving members of the State Patrol to get the blood from the St. Paul Center of the American Red Cross to this hospital. And that first call went to Michelle. Our pilots happened to be in the air in the metro. That's Todd Merwin here. You can see one of our pilots. They were already flying in the helicopter. As the road trooper was taking the blood from the Red Cross to the St. Paul Airport, our helicopter was landing and they converged. The blood goes from the trooper's car to the helicopter. The helicopter begins flying it direct to the Hutchinson Hospital with the intention of landing here. As they got closer, they could see that there was already an air ambulance landed on the pad because they were preparing and prepping to get Jenapher out of here as fast as they could get the blood to her. So the pilot made a great decision and landed at the airport just a few miles away. Meanwhile, coordinated with a trooper who happened to be just 5 miles outside of Hutchinson to get to the airport in Hutchinson. That trooper got the blood here, and the rest is the story that other people can tell. But our job is to get the blood here as fast as we possibly can. Many troopers are involved in this. I've done it myself, where you have blood in a cooler on your front seat, and you often, if not never, know where or why it's being transported. And so today, it's just a deep, deep moment of pride for us to recognize the life that's saved as a result of the efforts of so many people, including our medical professionals, including the Red Cross, including whoever donated that blood that got here, and including the State Patrol. So I'd like to introduce Trooper Brett Stricker to speak on behalf of the members of the State Patrol that are troopers for how that blood got here and to give his commentary and answer any questions. So, Trooper Stricker.
Thank you, Colonel Langer. While I'm up here speaking today, I just want to make sure that we recognize that I played just one of the roles in helping Jenapher and getting the blood to the hospital. Trooper Derek Hoy couldn't be here today. He picked up the blood from the Red Cross in St. Paul, and he brought the blood to the St. Paul Airport, where myself and Chief Warrant Officer Todd Merwin picked up the blood. Todd was flying that day. It was my job to get out of the helicopter, run under those blades, which is pretty scary the first time you do it, and bring the blood to Hutchinson. When we arrived here, like Colonel Langer said, we couldn't land at the pad. We ended up landing at the Hutchinson Airport, which we delivered the blood to Trooper Matson and Trooper Knudsen, who then brought the blood here just a few minutes away. When we received the call, Todd and I were somewhere in the air over Minneapolis to St. Paul. Todd knew that it was a time-critical call. He answered for it right away, knowing that we can get there faster than any trooper could on the ground via that helicopter. Once the relay was over with, Todd and I had multiple conversations in the air that night and throughout the entire night about how the patient was doing. I say patient because we did not know who the blood was for at that time. We just knew somebody needed it. We don't normally get information of how these types of events turn out. I think I can speak on behalf of all of us that we were overjoyed when we heard Jenapher had made it. Our main mission is traffic safety, something we do well. But we do so much more. This is just one of many stories of how troopers make a difference every day. On behalf of the troopers, we are so thankful that Jenapher here is to tell her story. We also know that many others played a role, just like the staff here at Hutchinson Health Hospital. Without all of us working as a team, today might not have been possible. We may not have been here. But with that, there is some doctors here that I want to talk about their team's role. Thank you.
Okay. Hi, I'm Dr. Mary Bray. I'm an OBGYN, and I was honored to take part in saving Jenapher's life, and I also hold it to be a bigger honor to be part of this large team. We have no idea what's going on behind the scenes as we're in the OR working, and I'm amazed to hear of everything and all the efforts that went through with everybody to save Jenapher, to get her blood, people giving blood, people transporting blood. It's amazing, but look what we've got. Thank you.
My name is Brandon Tiemann, and I was personally responsible for Jenapher's care the night of the event. It started off as a routine delivery, and it kind of quickly escalated into a postpartum hemorrhage, which is a life-threatening emergency. And like Dr. Mary Bray was saying here, at Hutchinson Health, we're very thankful to have all the resources that we do. This is very much a team effort. We appreciate the ability to get the blood from these fine folks behind here that I've already spoken. It's just incredible. We order blood and we have no idea where it comes from. We just need it in our hands right now. And so the fact that all these pieces can work together, it's just incredible. During Jenapher's case, the last thing she told me before I had to put her off to sleep, being the anesthetist, was that she asked me if she was going to die. And frankly, when people ask me that, it turns out that they do. And so this is just a fantastic story of a life-saving emergency, and it's incredible to see Jenapher here with us today. It's all due to the team. Got a great team at Hutchinson Health, all the surgical people, all the lab people, all the nursing staff, the OB care. Just incredible. All of our surgeons and anesthetists. We had people coming in that were not even on duty just to help out with this emergency, and you don't see that very often in a small rural hospital. So we feel very blessed and super thankful that we got this great outcome.
I just want to take this time to thank everybody for coming out today. My main goal for this was to shine the light on the state troopers and the shortage of the blood, the blood donors. We definitely need a lot more people to go out there and give blood. I never took much into account when it came to giving blood. I always saw those places where they'd have it off in the corner, and I always thought, oh, that's a great opportunity. Now I'm going to become a big advocate for it. As many times as I can, I will try and share. Story about me is I have 3 beautiful kids. Each one of them was a high-risk pregnancy. I have something called cholestasis when it comes to having them. My third, the care team was very aware of that, and they were able to let me get all the way to 39 weeks, which is a blessing for me because the first 2 I had to wait till 37. Everything was going so smoothly until it wasn't, and that's the importance of having a good medical team. I want to thank you guys so much for being aware of my needs and just on point for that night. And thank you to the state troopers. I had no idea it was going to escalate to the point it was. If you guys weren't there, if you didn't receive that call, who knows what would have happened within that extra couple minutes if the helicopter wasn't available. You guys have been so great in everything you do, and thank you for saving the lives. My kids have their mom, so thank you.
What a great story. On behalf of the American Red Cross, I'd like to thank the Minnesota State Patrol for their incredible work. Hundreds of times over the last few years, they've made these life-saving deliveries, and we are in debt to them for their hard work. Tragically, emergencies happen, and when they do, it's critical that hospitals and patients have life-saving products available to them when they need them, just as in this situation. When the time is of the essence, we call our amazing state troopers to make an emergency blood run. They deliver additional units to hospitals from the Red Cross facility in St. Paul, and in these situations, lives are literally on the line, and we are truly appreciative of them. We're grateful for the Hutchinson Hospital and all their staff that when they called on July 21st, we were able to respond to their urgent need and enlist our troopers for help. Time was everything, and they delivered on time. Some of you may have heard we were experiencing a severe blood shortage across the entire nation this summer, and we are. This story shows the importance of blood donation and having blood on shelves when emergencies happen. Blood collections and blood donation is a key part to our healthcare system, and I encourage anybody that can to please donate when you can. Every donation might be the one that saves a life. Again, thank you to the Minnesota State Patrol on helping this life-saving delivery. Thank you for the medical team. And thank you.
Thank you.
And as always, we encourage you to help Red Cross or any blood bank. And thank you, Minnesota State Patrol, and continue to save lives on a daily basis. Thank you.
With that, we'll open it up for questions for any of our guests or speakers.
From the time it took for you guys to get the phone call to have the blood delivered to here, do you have a time on that?
I do. From the moment that we received the call to the minute that it arrived here, it was 1 hour and 5 minutes.
That's pretty good.
That's fast.
That's really good.
Yep. Troopers are exceptionally good at what they do. They're exceptionally good at what they do. Our dispatchers are exceptionally good at what they do. And when they get this call, they start figuring out how to get it from point A to point B as fast as they can, whether it's on the ground or in the air or a combination of both. And the credit is to the work that they do every single day to get it there. And then the results speak for themselves. And none of it would happen without the exceptional medical staff that believe in what they do. You can see it in their eyes how much everyone behind me believes in what they do.
What kind of training going on? I mean, do you guys train for this? I mean, when that phone call comes
So it's a great question. We have a lot of training involved with the State Patrol. Running blood or doing relays is one of the things that we train on, particularly with the troopers that work in downtown St. Paul, because that's where it originates out of. And so they're the ones that do this the most routine, and then they get it out across the state. And so one of the values of the State Patrol is we're a statewide organization that sees no jurisdictional boundaries, so we can get it from one spot to the next to each trooper as it gets where it needs to go. And sometimes it can't go by air. If there's weather or other issues, we have to get it by ground, and we get it there as fast as we possibly can. But you know, this was just good decision making by exceptionally talented people to use the resources to get it here as fast as we can. It's not a question of how to get it here as cheap as possible. It's a question about getting it here as fast as possible, because we trust that when they call, it's about getting it here to save a life, and you can't put a dollar on that.
Any other questions? Jenapher?
Yes, sir.
Any plans for more kids?
No, unfortunately, this all resulted in a hysterectomy, so I would not be able to have any more children, even if I wanted to.
What you felt when you came out of surgery and realized you made it?
Definitely very just thankful. That first moment I woke my first question is, where's my husband? And then where's the baby? You know, how did she make it? The first thing I remember before going under is that she was also having trouble breathing. They had to take her to do to dry up her lungs. Once again, thank you so much for what you guys did for her while I was being tended to. So I didn't even get to see her within 48 hours after everything that happened. Being told I was flown to Abbott was a surprise. You know, I thought I was still here at Hutchinson. So that was something. And then when I came to and realized how sore I realized it was a lot more in depth than just the routine baby. So it was all a shock, but we came through very well. Baby's just fine, yep. She had to be on antibiotics for 48 hours. She got ambulance to the Children's Hospital out in Minneapolis with me. They monitored her, and she recovered just as well. And we spent a good 5 days in the hospital together. And yeah, now we're home and recovering and waiting for school to start and just kind of getting back to it. Not before today, no. This is the very first time I met them all. Wonderful human beings. Thank you for what you do for everyone. Thank you for this awesome opportunity to be able to meet you. Maybe one of my kids will be a state trooper one day.
Any other questions?
Just quickly from the medical team, what do you do when you do run out of blood? How do you keep things kind of on hold, so to speak? Waiting for the blood.
Yeah, so that's why it's so important to get the blood. We can use certain medications and things like that to to take the place of the blood, but at a certain point it becomes critical that we just need blood in order to keep the body's circulation moving forward, especially with massive blood loss. So we can buy some time with some medications and some other medications, different types of fluids and things like that, but none of it takes the place of blood in the end. And so really we're kind of on borrowed time as we're waiting for that blood to arrive. So thank you again, incredibly important. Sorry, say that again? I guess I'm not sure. Sure, yeah. So we don't really have a decision making in that process. We just know from a clinical perspective, like when someone needs the blood, we're not really involved in the allocation of blood and who gets it and who doesn't, but more just when the individual patient's vital signs and symptomology kind of show us that they need it, then we order it. And like I said before, we don't necessarily know where it comes from, so it's incredibly awesome to hear that process behind us here and how it becomes available.
Yeah, I can answer that. When we have shortages like this, our medical directors and American Red Cross work with all the major healthcare systems to try to triage situations. Often in blood crises, postpone elective surgeries or things like that to try to allow us, to be able to move it around. Most of the time, we can get it figured out, but that's why we need people to donate blood every day. It's something people don't think about, but it's there, and it's a key part to our healthcare system, and it just takes, a little pinch in the arm and a few minutes, and you can help somebody out and save a life. So.
Any other questions? If not, just two housekeeping points. Jenapher is available for any one-on-ones after we conclude here today, and you can certainly take advantage of that opportunity. Also, the State Patrol helicopter is at the Hutchinson Airport, and the family will be going over there to take a look at it. You're certainly welcome to go to get any video or shots from there as well. Okay? That concludes our event today. Thanks, everybody, for being here.
Could you maybe just say that at the mic?
Could you step up to the mic?
Pick it up here.